The cluster B personality disorders are characterized as being wild. And the reason we say that is because these people have dramatic, emotional, or erratic personalities. In other words, they're bad to the bone. Now remember, the B's in bad to the bone will be for cluster B personality disorders. These patients have a genetic predisposition for mood disorders and substance abuse. There's 4 main types of cluster B personality disorders, the first of which is the antisocial disorder. People with antisocial personality disorder often get in trouble with the law because they disregard the rights of others. By definition, this disorder must occur after 18 years of age, and the patient must have been diagnosed with conduct disorder before the age of 15. Second one is borderline personality disorder. These patients often have unstable moods, a sense of emptiness, and may even engage in self-mutilation. The defense mechanism of splitting is often used by these patients. So remember these 2 facts as they can show up in the description of these patients. Unstable mood, sense of emptiness, self-mutilation, and splitting, referring to thinking of 2 groups, one group as all good, one group as all bad. Remember the example we used of the patient who thinks that doctors are all good and nurses are all bad. The third one is histrionic personality disorder, where patients are excessively emotional and attention-seeking, and this can cause them to be sexually provocative and overly concerned with their appearance. Histrionic is a word that means excessively theatrical. Excessively theatrical. Kind of like the drama queen. So look for this sort of description in a clinical vignette. And the last is the narcissistic personality disorder, which is when a patient has grandiose beliefs about themselves and a sense of entitlement. They demand that everyone else around them gives them the best, and they don't respond to criticism well. Think of the classic Greek myth of Narcissus, a man who fell in love with his own reflection. So, if you saw a patient in a question stem who frequently had bursts of extreme anger and frequently threw things at their friends and would occasionally cut themselves, what would they be diagnosed as having? They'd probably have borderline personality disorder. The last cluster, cluster C, refers to personality disorders that can be described as worried. And these patients are often anxious or fearful, and they have a genetic predisposition for anxiety disorders. There's 3 main types, and the first one is avoidant personality disorder. This is where patients are hypersensitive to rejection and are very socially inhibited or cowardly, despite their desire to want to form relationships. They want relationships with others, but they're just so scared of rejection. This is unlike schizoid personality disorder, which we discussed earlier, where patients may be socially inhibited as well, but they don't care about having relationships. Whereas people with avoidant personality disorder, they want the relationships but feel inadequate. And schizoid patients voluntarily withdraw. The second type of cluster C disorder is obsessive-compulsive personality disorder. Now, we discussed this earlier when we talked about obsessive-compulsive disorder, which is characterized by patients who have both obsessions and compulsions to help alleviate their obsession. Now, the main difference is that now we're talking about obsessive compulsive personality disorder, where the patient's behavior is actually consistent with their actual attitude or beliefs, meaning that they think there's nothing wrong with their perfectionist behavior. In other words, their behavior is ego-syntonic. So these people are usually known as controlling perfectionists, and because their behavior is consistent with their beliefs and attitudes, we call this ego-syntonic. The last one is dependent personality disorder, which is characterized by submissive and clingy patients who often have low self-confidence. So imagine a clinical vignette where a college roommate has no friends and no significant other, but constantly says that they feel lonely. They also decline every time someone invites them to go out to parties. Now, what might you think this guy has, or girl? The answer is avoidant personality disorder, because they complain of feeling lonely, but every time they're invited to go out, they decline, probably because of fear of rejection. Flash quiz. A well-dressed patient storms out of the office, exclaiming doctors do not respect patients' time. What personality disorder is this? Now, there's nothing wrong with being well-dressed, but a well-dressed patient that has an out-of-proportion reaction, such as storming out of the office when having to wait, is more likely a person with narcissistic personality disorder. And, of course, this one action is not enough to make the diagnosis in real life, but that would be your best answer choice. As you may have noticed, there are a lot of situations in the previous slides where the prefix schizo was mentioned. And historically, this has been pretty confusing for people. So now we're going to remedy that. You can think about some of these terms as if they were on a spectrum, even though they aren't necessarily on a physiological spectrum, but it's a way to conceptualize the differences. For example, schizoid is a personality disorder. Personality disorder, where people act eccentric and tend to withdraw socially. Whereas schizotypal is a more advanced form of schizoid, because patients are not only eccentric, but they also tend to have bizarre and odd thinking. Then schizophrenic patients are a level above that because they have even more odd thinking, along with the other clinical criteria that we discuss in order to make the diagnosis of schizophrenia. And it also tends to be more limiting of their function. And finally, schizoaffective disorder is even a step above that, where it's not necessarily worse, but it adds another element, which is the mood disorder. So the psychotic symptoms are not necessarily worse than schizophrenia, but the added effect of a mood disorder is what makes this a step above schizophrenia. And remember that this mood disorder can be either bipolar disorder or depression. Now, depending on the time course of schizophrenic symptoms, you can get a different diagnosis. If symptoms last less than 1 month, then the patient has brief psychotic disorder, which is usually stress-related. Symptoms lasting between 1 and 6 months is schizophreniform disorder, and symptoms lasting greater than 6 months is schizophrenia. The next set of disorders is often mischaracterized in popular media, so it's important to know the true definitions of these terms. The two main diseases that we're going to discuss are anorexia nervosa and bulimia nervosa. So anorexia nervosa is characterized by excessive dieting with or without purging. Purging meaning vomiting the food or taking laxatives to quickly remove the food from the body so it's not absorbed. These patients have an intense fear of gaining weight. To have anorexia, patients must have a body weight less than 85% of their ideal body weight, with a refusal to gain weight greater than 85% of their ideal body weight. The DSM criteria also require patients to have had 3 missed menstrual periods consecutively if the patient is a woman. Anorexia nervosa is associated with decreased bone density due to decreased estrogen, and this leads to metatarsal stress fractures. In addition, patients also have anemia, depression, and electrolyte disturbances. In fact, what would be the most likely electrolyte problem in these patients? The answer would be hypokalemia, and that's because of the purging as well as the extreme dieting. Bulimia nervosa is characterized by binge eating with or without purging. These patients will often self-induce vomiting following a meal or use laxatives or diuretics to lose weight. One distinguishing feature of bulimia versus anorexia is that bulimia patients often maintain normal body weights. However, this disease is associated with parotitis and enamel erosion due to repeated vomiting. The repeated vomiting also leads to electrolyte disturbances. Can you guess which ones? Hypokalemia, hypochloremia, as well as sometimes alkalosis, because they're vomiting hydrochloric acid. That's going to lead to hypochloremia and alkalosis, and diarrhea will lead to hypokalemia. So, what kind of alkalosis? It's going to be a metabolic alkalosis due to the loss of hydrogen ions from the stomach. And how are they going to maintain that alkalosis? It'll be due to a contraction alkalosis resulting from the hypovolemia. Now, as seen here in this picture, patients can have what's called Russell's sign, which refers to calluses on the dorsum of the hand, and it occurs due to repeated attempts at vomiting as patients' knuckles rub up against their teeth as they try to induce vomiting. Flash quiz. A 20-year-old man is seen by a physician for the 3rd time in 3 months. At the first visit, he was brought to the emergency department by his mother after swallowing toilet bowl cleaner. He told the doctor that he took the cleaning product to cleanse his body from the aliens that had forced their entry and possessed him. Today, the patient appears unclean and disheveled, and his mother reports that he has become progressively withdrawn and expressionless. 4 months ago, the patient witnessed the gruesome death of his father in a drive-by shooting incident. Prior to this incident, he had a normal and healthy life. What's the most likely diagnosis? It's most likely schizophreniform disorder. He meets the criteria for schizophrenia with the delusions and social withdrawal, but it's been going on for less than 6 months. So always pay attention to the time frame in order to avoid losing points. We can't make the diagnosis of schizophrenia yet because it hasn't been at least 6 months.